Advances in Laparoscopy and the Operative Laparoscopic Workshop. It's a moment of great pride and honor for us today to have such esteemed doctors from all over the world here today. It's an international faculty and it's a real pride and honor for this college, and this day will be embarked in its history. I welcome all the guests and I would request our worthy ma'am, Dr. Sumanpuri, the chief organizer of this CME and workshop. She is the professor and head of unit in Department of Obstetrics and Gynae, DMCH Ludhiana. I would request ma'am to please welcome Miss Catriona Stalter. Miss Catriona Stalter is a consultant at the Queen Charlotte and Chelsea Hospital, London since 2007. She is a leading clinician in early pregnancy and acute gynecology. And she is the one who actually started this unit in the Queen Charlotte and Chelsea Hospital, London. She is a passionate teacher and a clinical trainer. She is also an RCOG college tutor at the Imperial College NHS Academic Trust, London. We welcome you heartily, ma'am. Next, we would like to request our Professor, Department of DMCH Ludhiana, Dr. Sunil Juneja, to please welcome Dr. Jen Chatterjee. Dr. Jent is a senior registrar and subspecialty fellow in the gynecology oncology at the Hammersmith Queen Charlotte and Chelsea Hospital, London. He has been extensively involved in the postgraduate education in the UK and the course director of the extremely popular MRCOG Part 1 revision course at the Imperial College, London. Next, we would request Dr. Kanupriya to please welcome Dr. Surgeon Sasso. With a bouquet, he is a member of the Royal College of Surgeons since March 2011. He has completed a 3-year PhD program at the Imperial College, London. He focuses on aspects of fertility preservation, especially anatomical, immunological, and psychological issues related to the uterine transplantation. Dr. Pooja is not there. Next, I would request Dr. Asmita to please welcome Dr. Gurleen Wander, who is a senior house officer in obstetrics and gynecology at the Queen Charlotte and Chelsea Hammersmith Hospital, London. She has cleared her MD Obs in Gynae and was the best postgraduate MS in the University of Baroda, and she has also recently cleared her MRCOG Part 1. Thank you, one and all. It is said that whenever a student is ready, the teacher arrives, and so have they. They're here to drive us into the sea of knowledge, and we are ready to do that. So may I please hand over the mic to Dr. Jen Chatterjee.
So much. So I'm going to start off by thanking all of you for this very, very warm welcome, which, to be honest, we're not used to that much. And these lovely, lovely flowers, I think you all have really made us feel very welcome. We are very proud and privileged to be here today among all of you, and I hope these next 1.5 days are going to be very intensive. You will get what we want to deliver out here about the MRCOG Part 1 exam. We think it's a very prestigious exam. You're going to understand the principles of how we go about preparing for this exam, how to take it, how it will benefit you, and above all, I hope you're going to get some knowledge about the various things that we are trying to tell you. So a lot of you probably know what the Royal College of Obstetricians and Gynecologists do as a professional body in the United Kingdom. It's actually not only a body which has its presence in United Kingdom, it's got its presence all over the world, and it has got fellows and members of 120 countries. It was established way back in 1929 and is located now at the Sussex Place in Regent's Park in London. and its main motto is to drive improvement in women's health care. The college has more than 12,000 members residing all over parts of the world, and about half of them live outside the UK. So what the college really does is it promotes standards of care in obstetrics and gynecology by a program of research, publication and review. It's heavily involved in monitoring the standard and the quality of practice in the United Kingdom. It has got various members which are involved in publishing informational guides, which we call national guidelines. It has got a scientific advisory committee, ethical committee, and various other committees, and organizes worldwide conferences through its fellows and members. So the RCOG is responsible for developing a framework and curriculum of postgraduate training in obstetrics and gynecology in the United Kingdom. So the MRCOG, which is the membership of the Royal College of Obstetrics and Gynecology in the UK, is an internationally respected as a standard qualification for career progression in our specialty. As I said, it's recognized all over the world, and acquiring the membership is seen as a way of progression and an important postgraduate qualification in our specialty. The membership exam was first held almost 80 to 90 years ago for those who intend to specialize in obstetrics and gynecology. The present format of the exam is a two-part exam, with the part one being a written exam, mainly evaluating trainees and people who want to achieve this qualification about their aptitude in applied clinical aspects of the specialty. Whereas the part two is more of a clinical exam, which involves two parts. One is a written part, and a part three, which is the OSCEs, where you go through clinical stations. This might change in the near future, and at the college we are contemplating whether we should change this to a three-part exam with an MRCOG part 3, which will be purely OSCEs, but at the present moment we still have a part 1 and part 2. So once you attain the membership and you've been to the membership ceremony at the college, you get the letters MRCOG written beside your name. The MRCOG is an award which is given by the council at the college for those who pass all parts of the examination. So it has got some other benefits as well, getting your part 1. We in the UK promote many international graduates who want to come to UK for short periods and want to learn the clinical aspects of our specialty. So we have a couple of schemes which are run by trusts, are run through the college, and one of them is well known to be what we call as a double sponsorship, where an MRCOG or a fellow of the college holder promotes a trainee from this country and is supported by a member or fellow in UK, and they come and train for a fixed period of time. And to do that, you need your part 1. We've also recently launched what's known as the Medical Training Initiative Program at the college, which is called the MTI, which has got a similar kind of requirement where you have to do your part 1, and then you come over for a fixed couple of years in the UK to clinically train and understand the practices in UK which you can apply in your resident country. So the benefits are there's a obviously exchange of information. You acquire knowledge, skills and techniques offered by UK's NHS, and these skills go on to help improve patient care in your home country on their return.